We spend the most amount on healthcare and we have the worst outcome. We are here to help people find solutions. Getting pushback shows that we're disrupting something, and I like that.
A whole 360 approach to health.
That it's this inside-out approach to health and wellness.
We are being poisoned. The food, the environment, mold toxicity and yeast and cancer is very real.
People are on these things and they don't know who to listen to or not listen to, right?
I know the business model. It's fear.
It's unbelievable.
The diagnosis is the disease. You got to get off the sideline, you got to get in the game, and you got to try things.
Dr. Craig Koniver, my doctor, and his lovely glowing skin enthusiast, amazing wife are back on the show. This is their third time.
Yeah, thank you guys. It's an
Yeah,
honor.
thank you.
We love
Awesome.
having you guys on.
I would like to kick this conversation off with talking about a whole 360 approach to health.
Mm.
Because when I say that you're my doctor, I don't mean like the doctor that people are thinking in their head where I go for a yearly checkup and see you never.
Right.
I'm talking with you and over text. It's a very like wellnessy approach. How would you describe all the touch points that you do from a 360 perspective?
I think for me, it's about building relationships, and I think the way I look at it, part of my job, what I enjoy doing and the passion is helping empower people to be sovereign over the choices they make. And, a kick that I've been on recently is just, kind of calling out the truth of things. We are being poisoned, like literally poisoned with the food, the environment, with all the non-native EMFs. And as a country, we spend the most amount on healthcare and we have the worst outcomes. Right. If we look statistically, greater than 50% of adults in the United States, overweight, tired, depressed, on multiple pharmaceuticals. And that is the standard of care. And so for me, it's like, if I can get to know the people I work with well, we can transcend all of that and cut through that and find solutions. And it's a journey of solutions. And everyone has different goals. Everyone's an individual. Everyone comes to it with, some people want to lose weight and some people want to work on their skin and some people want to detox. And there's just so many options. But I think what I'm enjoying now is really getting kind of to the crux of why are we, lying, and being a medical professional and being a part of that. Right. And we saw that with the whole COVID thing too, is a lot of lying going on.
When you say that, why are we lying? And I think especially with everything that we just went through with COVID, I think there's a lot of skepticism now around medical care and people don't know who to believe or what to believe. And I think a lot of people that were considered skeptics have been proven right in many cases. And and it was a very divisive time.
Sure.
And people are now just like, well, then who the hell do you believe? And what are the things we should be paying attention to or not? Like, where do you start with all that and land with all that? Because I don't want to diminish the entire medical community, but I think there's a lot of skepticism now because a lot of people that were maybe in positions of authority have maybe misled some people. And I think people became aware of that. And now people are like, well, then what the hell's the truth?
Yeah, I think it's hard. I think it's hard because you have the conventional medical people, which is dictated by the pharmaceutical model. And not that there's anything wrong with that, right? I mean, the modern day medicines are great and they serve a purpose. Then you have a lot of the fitness gurus, people who are telling you have to work out and be exhausted every day to, meet your goals and fast and do all these crazy things and get in a sauna every day and cold plunge. And it's all data driven. And it's very hard for people to know what's authentic. And that's why I'm a big fan of letting people experience stuff. And I think the key though is, people finding harmony within themselves by trying things. And I think this idea that, okay, I have to go put my foot on the gas all day long to be healthy and seek some measures like longevity markers doesn't make a lot of sense. So to answer that question more directly, I think it's by direct experience, right? Like everyone has to figure that out for themselves. And that can be hard for people, right? And that's the trouble is a lot of people, in our society from a power position, like you're saying, have given us misleading information. And it's very challenging for people to know what's right. But I think, I don't think people have to say, I'm going to see my doctor just because they're on the corner, they take my insurance. I think we can get beyond that. I think we can find people that we relate to who seem interested in helping people. And there's a lot of great people out there.
I think what's so great about you is you do feel like it's a curated, customized experience tailored to meet the patient's needs and wants. And I think the personalization is so important. Do you get pushback from the medical community on your avant-garde way of doing things?
I have gotten pushback. Yeah. More
How do you
so
handle it?
recently. It's confirming and reaffirming that I'm on the right path.
Yeah.
Yeah. I know that, we are here to help people find solutions, authentic solutions, and getting pushback shows that we're disrupting something. And I like that, and so we kind of operate on an island to ourselves, and that's good, because getting really authentic and real with people is really important, right? Because if we're just going to stay at the surface level and say, oh, you need all of these drugs and processed foods and, crazy exercise to be healthy, that's just not true. And most people can't keep up with that. So to answer your question, yeah, we definitely get pushback.
What are you seeing people that is working? What are things that you're doing for your clients that you see working on a big mass scale?
I think what we're good at is being there with people to, help map out, kind of, for example, we keep it really practical. Like someone wants to lose weight, right? And we can talk about, okay, you're here, point A, and you want to get all the way over here to point B to lose weight, and you want to lose 10 pounds or 20 pounds. And for everyone, that's a little different, right? And so we don't want to use generic advice, which is, change up your diet, work out more. But it's going to take a lot of zigs and zags and go different ways. And so what I think we're good at is providing solutions and then being there when things don't go well and going awry or, needing to edit the plan. And that trust that we form and that rapport is really important, because really the moment it works is when someone wants it to work for themselves, right? Like when that light bulb goes off and says, I can do this, and that there's tons of options and I want to be sovereign over the choices I make. That's when it works. It doesn't work. The paternalistic medicine, the model in medicine doesn't work where the doctor's saying, you have to do this, right? We're failing at that. But it does work when the patient raises their hand and say, I feel empowered to make choices in my life that, I really want to see a positive impact.
I have a two-part kind of thought. One, we have a personal relationship. So I feel like it's the first time in my life that with a doctor, I feel like I can say what I'm actually thinking and feeling, if that makes sense. I think some people get intimidated going to the doctor and you're in this office and you're letting them do the, so we have that rapport. And then my second follow-up is Kelly, you have a much different relationship, but in the relationship you have with Dr. Craig, how do you utilize his expertise? Because I think that's going to be revealing in the way that people could potentially think about tapping in to a doctor with this experience.
Well, sure. So on the skin side, that's just the outward reflection, right? Yep. So it all comes back to what's going on the inside. Not just from a health perspective, but a mental perspective as well. So I think that's our entire approach, is that it's this inside out approach to health and wellness, and that's then reflected in the skin. So I pull him in routinely. If a patient is struggling with acne, we've tried a host of different topical ingredients. Maybe we've done a laser treatment. They're not getting results. We want to look at the blood work, So,
but also for you personally, if you're feeling is he your doctor? Or,
oh yeah,
yeah. So that's
he's my doctor. Yeah, what kind of doctor? Are we talking porn doctor?
He's my doctor.
So we met in 2015. Kelly was my patient, and then very shortly after that, I fired her. I literally fired her as a patient. I said to her, "I'm going to fire you as a patient because I want to ask you out." And then
that's correct.
But I guess
did you like him?
Oh yeah.
So you were into it.
Not as much as him, of course.
Yeah.
But yeah.
Yeah, no, you never let them like you. This is the trick. You always make sure that they like you more than you like them. I never want to, you can love me way more than I love you. That's how it always needs to be.
I think that's good. I think that's a good policy.
Yeah.
I do too.
That works well.
Mm-hmm. Yeah. Someone's going to call me sexist now, Yeah, never.
Oh, good.
So, but what I'm saying is because I guess what I'm trying to get at is the things that I would ask you or bring to you because of the relationship we have is different than any doctors I've had before. But I would imagine with you, and I think it's informative because some people maybe sometimes they're having issues and they just don't feel as confident or comfortable tapping in, or when are the times you actually go to him and say, okay, I need some medical advice here.
Right now,
we spend the most amount on healthcare and we have the worst outcome. We are here to help people find solutions. Getting pushback shows that we're disrupting something, and I like that.
A whole 360 approach to to health.
That it's this inside-out approach to health and wellness.
We are being poisoned. The food, the environment, mold toxicity and yeast and cancer is very real.
People are on these things and they don't know who to listen to or not listen to, right?
I know the business model. It's fear.
It's unbelievable.
The diagnosis is the disease. You got to get off the sideline.